I'm Stephanie Grana, and today I'm going to provide clarification of some common terms involving orthopedic and spinal injuries. Spine. The spine is actually composed of 33 bones, and there are 4 regions: the cervical, the thoracic, the lumbar, and then the sacrum or the coccyx. And those 4 regions together protect your spinal cord, which are the nerves or neurons that go from the brain all the way down to your tailbone. You have the abbreviated letters, and then that corresponds with the level of the spine that has been injured. Sometimes there'll be a grouping, for example, C1 through C3. That simply means that there are 3 levels of the neck that have been injured. So those are just abbreviations that you might hear from a medical provider or read in one of your medical records. Paralysis. Paralysis is a loss of function, and it can be divided into 4 regions. Monoplegia. That involves the paralysis or inability to move one arm, one leg. Hemiplegia. What that involves is one arm and one leg on the same side of the body, which can often result from a stroke. Paraplegia is paralysis below the waist. This can often result from a spinal cord injury. Quadriplegia involves paralysis from the neck down. Degenerative disc disease is simply a natural condition. It happens to people over the age of 40 or 50 or 60. We just don't know that we have it. And then what can happen in a car accident is the degenerative disc disease, which is just a normal condition of wear and tear. It becomes symptomatic, meaning it causes pain. That pain can then be analyzed to determine if you have what's called a disc bulge, which is that little spongy material in between your vertebrae that expands and causes pain. You can also have a rupture of that disc. X-ray, MRI, and CT are all ways that physicians can literally look inside your body. An X-ray is a term we're most familiar with. It involves radiation. It is available at most local emergency rooms, and it takes just a few moments. An MRI usually takes about 30 minutes to complete. It does not utilize any radiation, but it is not to be used for people who have implants or pacemakers. CT, or computed tomography scan, does send radiation through the body. It is ideal for blood clots, bone fractures, or organ injuries like an appendicitis. A CT scan is more sophisticated and powerful than an X-ray, and it does give what's called a cross-sectional image of the injury. A CT scan can normally take about 3 to 5 minutes, and it also can be used for persons with implants or pacemakers who cannot have an MRI.